let's talk about the ongoing COVID-19 pandemic. Concerns continue to grow over the coronavirus mutations, which might reduce the effectiveness of the coronavirus vaccine. We're joined now by Dr. Uche Blackstock, CEO of Advancing Health Equity and Yahoo News medical contributor. Doctor, great to see you. It's been a little bit of a time since we last talked. So as I was mentioning, those mutations and those strains, and it seemed as at first everyone was saying, listen, don't worry. This happens to viruses all the time, which is true. We know that viruses do mutate, but I feel as if the news around these mutations has been getting more and more alarming as the days and the weeks go on. So I guess the question I want to ask you here, how concerned should we be about these viruses, these mutations and these new strains?
Well, first, thank you so much for having me. And I agree. I think that as we've been learning more about these variants and we've seen them spread to a further extent, definitely the situation seems a little bit more grim. But what I would say, just to put everything in context, that this means that we really have to double down on our public health measures. That we're at this point where we don't have enough vaccine supply, and then the variants are on the horizon. And by March, the 117 variant is supposed to be the predominant type. And so we're in this really difficult place right now. But then we have cases going down. And so what I would say to people is, yes, we should be humbled by these variants, but know that public health measures prevent their spread, and that we have to really get organized on creating that robust vaccine delivery infrastructure so we can get shots into as many arms as possible. But I will say that the next 1 to 2 months are going to be pretty difficult and challenging months for us.
How would you more broadly describe the pandemic right now? Because it seems a little bit like hypocrisy. I shouldn't say hypocrisy, but it seems a little bit strange, right? That we continue to hear that these mutations are out there, that they might be more contagious. But as you mentioned, we do have the case counts coming down, the hospitalizations coming down. So I guess, which is it? Where are we right now in this pandemic? Right. Are we rounding this corner or are we not?
I think that we could be rounding the corner. And the fact is that what we've seen is many of the restrictions put in place by states, they actually work. So these mask mandates, restricting large gatherings, restricting indoor dining, it actually prevents the spread of the virus. And that's why we're seeing these reductions in cases, hospitalizations, and even deaths somewhat as well. But I think, again, we need to be humbled by these variants because all of this hard work that we've done not only could go to the roadside, but we also know that many states, such as my own here in New York State, we're starting to reopen a little bit more. We're starting indoor dining here in New York State again this weekend. And so my concern is that states are going to reopen too quickly, and we're going to see that case count go back up again just in time for the variants to be the predominant strain around.
So speaking about that, I'm also here in New York, and Governor Cuomo saying, obviously not, are we only going to allow indoor dining to happen again? They're thinking about reopening arenas, which I personally, I don't know if I want to be in an arena with thousands of other people. Are calls like that bad ones to make? Do you think that we are not quite there yet to be making those measures?
I would say that we should halt on any big decisions in reopening until there is not only enough vaccine supply, but that we have a critical mass of New Yorkers, Americans being vaccinated. This idea of opening up stadiums or indoor arenas, which really are probably the most dangerous places because we have people yelling, shouting, screaming, sitting closely together, and indoors we don't know what the ventilation status is. It could actually be potentially very dangerous. So again, I think that this reopening is happening too soon, especially given the fact that we don't have enough vaccines and we have the variants on the way.
I have about a minute left with you here, Doctor. I want to ask you about a move that Massachusetts is taking, which is that if you accompany an elderly person to their vaccination, that you yourself can also receive the vaccine. I'm wondering if that's a move If you have someone, for example, who's immunocompromised in your house, if they're eligible for a vaccine, if we should start maybe perhaps vaccinating entire households.
I think that it actually is, a decent idea. I think that it will help encourage more elderly people who may be shut in to come in for their vaccinations, especially to have someone who is either a loved one or well known to them. So I think we could actually see more elderly being vaccinated, and it's very likely that they'll have other people who are higher risk or in some of the other priority groups, and they'll be allowed to be vaccinated as well. So I don't think this is a bad idea, and I think it'll help encourage us to help get more elderly people out there, because we know accessibility is definitely an issue.
All right, Dr. Uche Blackstock, CEO of Advancing Health Equity and Yahoo News medical contributor. Thank you so much for giving us your insights as always.